Welcome to the Burn Bootcamp podcast. I'm your host, Morgan Kline, co-founder and CEO, along with my husband and company visionary, Devan Kline.
And together, with our amazing team, we are going to help you push past your limits, not just physically in our gyms, but right here, mentally, emotionally, and spiritually on the Burn Bootcamp podcast.
Together, we will take on challenges and break through barriers to transform into the best possible version of ourselves. We are more than a gym. We are a community. Your community. Let's go, Burn Nation.
Hey, everybody, and welcome back to the Burn Bootcamp podcast. My name is Devan Kline, co-founder and visionary, and I'm here with a very, very, very special guest today, dear friend of Burn Bootcamp. You can catch her on Burn on Demand in her core and pelvic floor series. Dr. Amanda Fisher is a doctor of physical therapy. She's in the building today. She prefers Amanda, so we're going to call her Amanda throughout the podcast today. But I'm so excited to have you as a doctor of physical therapy. She's also a CEO of Empower Your Pelvis, which most of you know her on Instagram for that content and marketing her business. She does a fantastic job of it and caught our eye being a member in Lee Summit, which is in Kansas City, Missouri. Okay. And so along with core and pelvic floor, she is here dedicated to you all to help continue to educate you on how to protect, how to strengthen your pelvic floor. Obviously specializing in women, but guys too. Listen, I use my pelvic floor when I meditate. Often I use it, and it's a muscle. And if we're about taking care of our body holistically, then we need all of the muscles holistically. Holistic means all, well-rounded. Okay, all right. We can't just show up on Mondays and do chest press like everyone likes to do in America. We got to think about the body from head, shoulders, knees, toes, inside, outside, support muscles, pelvic floor muscles to pectoral muscles, okay? And Amanda has a very, very special place, as I mentioned, in the Burn community. We're so excited to have you on the podcast today and just to really dive deep on this topic and talk about all things. We're going to go deeper, y'all. So if you've seen the core and pelvic floor material on Burn on Demand, then you get an amazing introduction, okay? So we'll recall some of that stuff, but we're also going to take you all a layer deeper so that you can continue your journey with Amanda, all right? Make sense? Say yes. All right. I got to do that, Amanda. It's corny sometimes when you do it in the middle of a podcast, but it's the brand,
right? You know people
right?
are saying it in their car.
Yeah, you guys are saying it in your car, aren't you? I know you're out there screaming at the top of your lungs by yourself. So let's get started. Maybe just give a little bit more color on you. I always like to, let you color yourself a little bit. And then out of all things that we can talk about today, we're gonna talk about pelvic floor, and I want to know why you went down this path in the first place. So let's start there.
Yeah. Thank you for that wonderful introduction. I'm excited to be here today. I'm Amanda. I'm a mom of 3 boys. I've been in sports my whole life, so I still consider myself an athlete, and thankful that Burn exists because that makes me feel like that every single day. But I decided I had enough injuries in high school playing sports, volleyball and basketball competitively, that I ended up in physical therapy. I feel like my whole high school career on and off, and then ended up teching there over the summer. Went to Mizzou, MIZ baby, and ended up going there planning to go to physical therapy school. I was an athletic trainer for the football team while at Mizzou for a short period of time, and then decided to go sports med. Well, lo and behold, we don't really have sports in grad school, so we started running a ton, a couple of classmates and I developed bladder leakage at 21 years of age. And no, I hadn't had children then. And I started having pain with intercourse, which now I know I have PCOS. So that was probably a puzzle piece back then too, that we were not aware of. But like anybody who starts a business, I feel like you do it because you kind of go through things on your own. And it kind of led me down a journey of not getting the answers I needed. And so I just kept searching, and then found a niche within physical therapy itself, being pelvic floor. At the time, there wasn't a clinic devoted just to pelvic floor diagnoses per se. So I graduated college and basically talked my boss into allowing me to start a pelvic floor specialty within the orthopedic clinic that I was at. So Thankfully, he allowed me to do that. And I built up a caseload of 25%, 50%, and then basically 100% of pelvic floor issues. And at the time, we were still treating pelvic floors with just Kegels, which we will get into later. And I started realizing, like, man, I'm seeing a lot of young athletes, like cheerleaders, softball, soccer players, that are having bladder leakage while they're doing their activity, or they're having some sort of pelvic pain. And from a muscle standpoint, it just didn't make sense why we were giving Kegels and we weren't addressing the issue with the movement. So that really led me down this whole path of eventually, years later, starting my own company.
Yeah, so you were destined to help the Burn Boot Camp population, the Burn Boot Camp membership, with this issue, these issues.
Right.
So let's start generally. And for those of you who are very educated on this topic, this may be a redundant question that Amanda answers. But for those of you who are not, I think it's important that we just start with like a foundational knowledge. So I'll ask the simple question: what is the pelvic floor and why?
Pelvic floor is a group of muscles at the base of the pelvis, and they control your bladder, your bowels. So you think like anytime you need to pee or poop, we don't want it coming out just, whenever. So they're supposed to hold.
No, we don't want that.
No. They're supposed to hold our goodies in essentially until we feel like a relaxed state. The muscles have to relax. They should relax in order to let things out. They also support our organs. So I like to think like how sports bra kind of support the girls. These guys are going to support your organs. So we've got bladder, we've got uterus for females, we've got our prostate down there for men, and then we've got our bowels. So they're supposed to keep our goodies in, hold them there. They work with our breath. So our pressure management, thinking like when you hear your trainer yell, like, blow out with movement, we want to blow out to help engage the core and pelvic floor naturally on its own. And then there's sexual and function too. So these muscles down here, if they're not working well, we're not really going to have, live up to standards with sexual function down there. So we definitely want to work on them.
Yeah, I mean, I definitely want to live up to sexual standards. I mean, that's something I think everybody wants. So, I mean, that's a universal reason to focus on it. I mean, that's such an important part of our life. It's taboo, and people are probably like giggling in their car right now because it's funny, to talk about the muscles that control your sexual organs. But hey, it is what it is.
They're down there for activities of daily living, whether it's bowel, bladder, or sexual function. All that stuff is kind of happening all the time.
Yeah, and so when it comes to exercise, right? Like, so take, obviously you're in Lee's Summit. You've been able to really help and educate a lot of women in Burn Nation, a lot of men in Burn Nation, but especially in your home gym, because you're right there and be able to be hands-on with them every day. So what type of exercises, like, how do you know, like, if you're in Burn and you're working out and you know that this should be something, your answer might be everybody should focus on this to some extent, which I agree. But like most people won't until something's wrong, and then they'll want to diagnose. Where do we usually see this pop up, in which women would say or men would say, yeah, I might want to get that checked out? Exercises, what type of camps?
Yeah, I would say like the athletic conditioning, burst training, those are big ones, because those are probably the number ones where you see people running to the bathroom, where they might get that bladder urgency. Or then I, being the PT, am like overanalyzing form to see when people might stretch out the pelvic floor, meaning like they're stretching out the front portion of their core, maybe with poor form as they're trying to lift a heavier weight, or they fatigue with jumping jacks or jumping knee tucks. And you can start to see with endurance after a while, if they have fatigued out, then we're losing that form, and they might have the bladder leakage, loss of stool. Some of my early postpartum gals or C-section moms might have pelvic pain or pain in the lower abdomen too with certain exercises as they're building up, again, endurance with plank holds or mountain climbers. So anything really with where we're having the bladder leakage, back pain and hip pain, I feel like is another one I see a lot too of. Sorry, jumped off of that one. And sometimes it's just small little pieces that you can remind them to fire the core with that activity, or make sure they're exhaling with that activity. But if they're still having those symptoms of the bladder leakage, the pain, then we might want to see someone to dive a little bit deeper to see what else is going on.
So it'd be fair to say then that if, like with all musculature, if you're not using it, you're going to start to lose it. Like if you don't hypertrophy, you atrophy, right? So when we start to think about Okay, let's put ourselves in a scenario of just a very familiar one for you and I. There's a 38-year-old mom of four. She has, four kids, and, three of them happen back-to-back C-sections, and, two are natural, and, just a common scenario of a woman with three or four kids. And she never knew any of this stuff. Like, this isn't like common knowledge, right? Which is why I wanted to have you here on the podcast and be such a big part of Burn, because as a trainer, I got an opportunity to see countless, and mostly women, I'm just going to give you my experience, like do jump rope and double unders and pee their pants a little bit and run to the bathroom and then be like, Devan, like I want to do double unders. It's important to me to reach my VO2 max. I know how important this movement is, but I can't stop peeing my pants. And that was like their one trigger. And that's how I got into it too. Cause I was like, I don't know, but pelvic floor sounds like something that you do when you poop or something like that, so, it hadn't always been common. And now that I've been through, so many different experiences with members, you start to ask yourself like, wait, this is very common and I'm not able to solve it. What's the issue here? And it was pelvic floor. And so I guess long story short, because I want to get to a question here for you, is when most women haven't historically had a foundational knowledge of core and pelvic floor to stay ahead of the curve, now they're playing catch up. Like how do you go about playing catch up? Obviously that's what you do for a living, physical therapy. And then how does that differ from general physical therapy where you get injured, you get a surgery, you go do rehab, you get on a periodization, you bounce back type deal. Like what's the difference? How is pelvic floor PT different than general PT?
Okay, so pelvic floor PT is different than general PT in the fact that if you're going in for, let's say, an arm, they're stretching your arm manually. Then you might learn how to do that with some assistance to get some range of motion. And then you're learning how to get that range on your own and then building up strength. From the PT pelvic floor side of it, we're much more, I would say, intimate, where the muscles are inside the pelvis. So if I want to know your range of motion, I would prefer doing an internal pelvic exam, muscular exam, to see what the heck is going in that dark room of tissue that none of us can see unless we can feel it. So you can feel it externally if you've got the right therapist to check that out, but a hands-on approach is just way easier. So an internal exam, we can see, is the tissue more tight? Is it contracting and relaxing the way that it's supposed to? What does the strength feel like? What's the endurance? And then I like to have patients not only test them out laying on a table, but then, because that's to me not real life, moms are not carrying their babies laying on their back. How are you moving with that kid, or picking up a purse or whatnot, sitting in the chair and moving from sit to stand? Are we holding our breath? So manually, I'm still internal doing the assessment. Is the pelvic floor being pushed down? What's the strength? What's the endurance like in that position? And then so moving from sit to stand, but then in standing, say they're also complaining of issues in standing, maybe coughing, sneezing, laughing, having some leakage, or in standing after they're carrying their baby for a certain length of time, they're feeling pain, pressure, or leakage. I want to know what's happening to that tissue too in the standing. So then I'm assessing the pelvic floor in standing, one gloved hand. And if they're jumping, or it's when they're lifting their kid or a certain amount of weight, then we're going to do that in standing too. And it might seem a little awkward, like, why would I go see anyone and let them do that to me? But it is so eye-opening. And then that patient can get an idea too. It's like, okay, my pelvic floor is really working for me up until like 15 pounds. And then over that 15 pounds, I'm fatiguing out maybe at like so many reps with 17 and a half. So when I go back to Burn this week, I'm going to focus on lifting 15 pounds for those 45 minutes of class. So I can still move and I can still start to build that endurance on the pelvic floor. But if I shoot up to 17, or I can do 17 for so many reps, because I don't want to go in there and continue to injure the tissue, but I want to keep my patients still on the floating floor, if that makes sense. We're just really trying to find that threshold differently than you laying on a table and somebody moving your extremity. We're moving the pelvic floor, but then we want to see it with functional movement as well. So that there's a similarity there of the functional movement. It's just way more intimate and up in under the hood, essentially.
Yeah. Yeah, for sure. I was like with you, like pretty much all the way till you said class. And I'm like, come on, Amanda, you know better than that. It's camp, not
Sorry,
class.
you're
No,
right.
no, this is a cultural thing. You guys get used to it. It's, the industry calls it class and we call it camp. Partly to be different, but also because it is a camp. You are in there and you guys are in the trenches
Sure.
together. So, and plus I don't know, Cody Burns, our franchise partner from Wisconsin, would text me. And if I made him do burpees one time because he called it class, not camp, I believe. And, and he would be mad at me if I didn't call you out on that, but
Thank you for not making me do burpees right now.
Did you go to camp today?
No,
this
I'm
morning?
solo
Or are you
parenting
going
right now,
tonight?
so I'll go tonight.
Oh, you're solo parenting?
Actually, I'm doing
Okay,
Burn On Demand tonight. So.
Oh, are you? Okay. Okay. Here's the real question. Have you ever gone back and done your own work? Like gone back and done core and
I have
pelvic
not.
floor? No, you're like, I was there, dude. I don't need to go back and do it. I was there.
No.
For the record, I've never gone back and done my own workouts either. I was just wondering if I was weird or not, but it's either we're both weird or neither one of us
I just
are.
don't want to hear my voice.
Okay, so this is great. And so now we are to the point where we're seeing you. And just to be clear, when you say glove hand, you're going for an internal exam. That means you're going up the cavities. Yep. Okay. On guys, that's the only other, there's only one cavity.
There's only one.
Okay, so you're using
It's
that cavity
rectally.
for guys?
You got it.
Okay.
Yep. And
Okay.
vaginal
All right.
or rectal, depending on what the client is complaining of for a female. So if a female's coming in with tailbone pain, I'm not going to try to go get to the tailbone vaginally. It's going to be a rectal exam because you can get to the tailbone right there.
Okay. That's good
Highly
to know.
recommend for anybody dealing with tailbone pain too. It's such an easy fix that it relieves the pain almost instantly.
When tailbone, describe.
So if you're
is that lower back extensors, tailbone?
If you're dealing with tailbone pain, like pain in the butt, literally from prolonged sitting, and as you move from sit to stand, you're feeling that twinge, go see a pelvic floor PT because they can do an internal rectal assessment and let that go.
Okay. Wow. Okay.
It's typically a muscle spasm.
Okay. Okay. So now we've seen you, we know that there's an issue. You're going to prescribe some type of treatment, some type of spot treatment to come see you. How does that work? Just give me a general timeline of what it might look like.
Pretty individualized. So if we find that the pelvic floor is more tight, then I'm going to tailor maybe their exercises for the next week as more mobility style, or learning how to let go of the pelvic floor, how to lengthen it, how to relax it, like you talked about with meditating. If it's true weakness, then I want to try to activate the pelvic floor more often throughout the day. I tip personally with my clients, I like to have them tailor their exercises around something they're already doing. And I take that from the Atomic Habits book.
Okay.
Coupling it. So especially moms, they're overwhelmed, they're busy. So I like to couple things with brushing their teeth, because that's something we do at least twice a day. Let's do some exercises with that so before I see you next. But the more often throughout the day, so we can see tissue change and activate the way that we need it to.
At the simplest form, is there some advice you could give to somebody that might not be having symptoms, but they just want to strengthen? Maybe you could explain what you mean more in depth at the 2-minute toothbrush drill that you're talking about.
So with brushing the teeth, my big thing's mobility. A lot of us aren't stretching or getting that pelvic floor and that full range of motion throughout the day. So after they brush their teeth, they hold onto the sink and they get into a deep squat where their pelvis is getting lower than their knees. They let their belly relax. They hold for about 10 seconds and then they're blowing out as they go to stand up. So as you're exhaling, that pelvic floor is rebounding and working how it's supposed to, but it gets to stretch out into full range of motion in that deep squat.
You said blow out on the way up.
As you exhale, your pelvic floor will kind of contract or rebound back up.
Okay, so you're squatting down, deepest squat you can. Your hamstrings are on your calves. You're trying to keep your heels to the ground, I'm assuming. Does that matter?
Doesn't matter, because I would love for anybody just to get that pelvis lower than the knees. But for range of motion and holding onto the sink, you should be able to keep those heels flat on the ground.
Okay, and if you can't, you're holding onto the sink, so you're not in jeopardy of your patella tendon or anything like that if you aren't used to squatting that low. And then you're down there, you're letting your belly relax. So am I going to take 10 deep breaths? Would you say
it'll
5
be
or 10
about
deep
5
breaths down there?
for those 10 seconds where you're inhaling and exhaling, 3 to 5 essentially. Breathing in and out, belly's relaxed because if the belly's contracted, your pelvic floor is contracted. And then you're just going to
Okay.
exhale as you go to stand because that'll make the pelvic floor contract. It'll contract the lower abs. So it'll give you a little core stability as you're moving from that squat to stand position.
Okay. And that's 1 rep, and you just do a few reps as you're brushing your teeth there?
All I ask from my moms is give me 10 seconds. And if we can accomplish the 10 seconds twice a day with brushing the teeth and I have them for that, then we're going more, but we're going to start small.
Well, I love that, right? You're barking right up my tree, I guess. Like it's about not breaking the promise to yourself that you were going to do, right? So let's introduce to ourselves the smallest viable, least intrusive promise that we can almost guarantee that we can get. Now we start to have some momentum around those experiences, and you start doing that every day, you're going to get some momentum. You're going to start feeling better.
Absolutely.
And then they can come see you, right? If there's any issues that persist. Yep. Do you generally think everybody should do that?
Yes. Yeah. Okay. Especially in our culture, like I feel like we sit a lot, but when you start looking at hips and knees, having been in the orthopedic standing or setting of PT, very few people want to get past the toilet height. And functionally, if you fall on the ground in your 50s, 60s, 70s, you want to be able to get up off the ground. We see it in other cultures, people squatting at stoplights, waiting to cross the street. We need to get back. Those hips and knees and pelvic floor were made for that type of range of motion. And if holding onto the sink and it feels uncomfortable on the knees or the hips to get down so low, don't go that low to start. See what you can handle first and then build up to sinking into it a little bit more and a little bit more as time goes on. But yes, I do believe we need to get that back.
So let's just say we're a Burn Bootcamp member. We are in the gym. We're, deadlifting our pelvis. We have perfect form. Our pelvis is below our knees. You're exhaling as you stand up. Is there a need for a more concentrated, non-loaded, just activation as well on top of that? Or is somebody who, with all intents and purposes has great form, do you think they're in jeopardy, and do they also need to take extra precaution?
I personally don't think we need to contract the pelvic floor in that setting unless they are somebody like a new mom who's dealing with the bladder leakage or the pressure. Then we might do it just to kind of remind those muscles how to work with the legs through those movements. But once we get it where we're not feeling the pain, pressure, and leakage, like we're advancing on, because those muscles are supposed to work hand in hand with our lower extremity, with our legs, with movements, without us having to contract it. Majority of the pelvic floor really is more involuntary than voluntary, meaning they should contract on their own. But there are periods of time where we need to remind them where we might be contracting. But if you're not having any issues in the gym while lifting weight, just focus on the exhale, because then the rest will follow.
That's great advice. Okay, so now let's talk about gender specificities for men and women. Any differences? Anything that you want to call out? Like I mentioned that to you. I think I can't remember if we were on or off air, but my meditation practices have led me to this style of meditation called Kundalini meditation, where you're basically taking the pelvic floor muscles, you're contracting the pelvic floor, then you're contracting the core and the diaphragm and the chest and the throat and the head, and you're trying to drive pressure, energy, up your spine from the base of your pelvis. It's thought that we carry a lot of extra stress and negative energy, etc., below the pelvis. And so, I understand through that practice why it's important for me, because it is the act that being able to control those muscles voluntarily for me is the act of releasing negative energy. And so I'm just wondering from, just an everyday type, maybe spiritual perspective. I know that you lit up a little bit when I started talking about it from that angle, but also then from a male perspective, a female perspective, what are the differences on that? Let's just say if obviously men don't give birth. So it seems to be, from my experience, a lot of the pelvic floor issues manifest postpartum, during pregnancy and postpartum, I would say is probably more accurate, but probably less before you have children than when you're nurturing in postpartum. Would that be correct, or am I off on that?
Well, let's just a lot of public.
You can educate me. Listen, I'm ignorant here. You got to educate
Yes
me.
and
That's why I'm
no.
the one interviewing you, because I actually don't know anything about it. So I'm a perfect person.
I
to
feel
interview.
like just with mainstream society, we've always said like it's normal if things happen because you've delivered a baby. So we have that in our head for years. But so often I will, especially in my practice, like I see way more issues with the pelvic floor when things are tight. And I lit up when you were saying like we hold stress and emotion. And I'm like 100%. That is probably a majority of our caseload with men and women is the tension and emotion and the high stress way society has kind of gone even since COVID. Where now our high stress used to be our moms, and then I would see our men in high stress jobs that were dealing with pelvic floor issues like urgency, frequency, pain with arousal, that sort of thing. But now we're getting our younger, like 18 to 22-year-olds that maybe COVID affected them during high school and they had to go virtual. And I'm finally seeing them 3 or 4 years later. And then I will ask the question, like, did your symptoms start when COVID happened? Like when you went home and you had an increase in anxiety, I'm guessing. And 9 times out of 10, yes, that's when it happened. And it all stems from the stress, anxiety. But those pelvic floor muscles, they contract with any kind of emotion, whether it's even maybe the mom doesn't think she's stressed and overwhelmed, but she's so busy and just constantly moving throughout the day, but she doesn't get a chance to slow down. Those muscles are going to be high and tight too. But we see it in both genders, all across the board. It doesn't really matter age when it comes to pelvic floor tension. I do see it probably in the younger populations. Things will get a little bit more weakened out where we might see a true weak pelvic floor as we get into like the 50s and 60s and 70s, but they still deal with tension too as they go through menopause. So does that help?
Okay. Yeah, that makes sense. Yeah, no, that makes sense. So tell me, just so I can understand this, tell me if I'm off or on. This thought just came to me. This could be completely like silly. You just tell me. I'm unafraid to look stupid. So when you say voluntary and involuntary, right? It reminds me a lot of like the tongue. Like when I'm stressed, if you just stopped in the moment of stress, you don't realize it, but involuntarily your tongue is pinned against the top of your mouth and you don't even know it. But if you are in meditation and you're feeling that stress, you can just like remind yourself, like relax all your muscles, and you can then voluntarily make it relax. And so I think about the pelvic floor a lot in that sense of when you're talking about stress, like there's a lot of stress and tension put on your neck here too, because of the position that you put your tongue in and your jaw, and like, we think we're not stressed, but then your jaw's tight and your tongue's pinned to the roof of your mouth and your brows are frowned. And it's like, no, that's actual physical stress that you could see. Is it similar to the pelvic floor, or is that analogy just terrible?
No, you're not terrible. Actually, in utero, a fetus at 8 weeks, head and the pelvic floor split. So they're the same muscles. So you're right on. So patients that'll come in with pelvic floor tension, you'll start to ask them, like, do you grind your teeth at night? Do you have TMJ? And majority of them do. They grind their teeth or they have tension somewhere in their jaw. And even with the pelvic floor, you can feel that during an internal assessment. Like if they get stressed when we're talking about something, that pelvic floor will go up. We work on breathing and moving the tug from it to a different position, and you can feel that pelvic floor come all the way back down. You can also feel this if, like, you can even put your hand over top of your pants on top of like the labial tissue for your females. And if you are talking, so this is another way that it's connected, you can change your voice tone essentially. So you can talk really high and you can feel your pelvic floor kind of shoot up, or you can talk really low and you can feel your pelvis come back down. So that connection is even there too, depending on how you're speaking when you get really excited, or how you're speaking with your family. Is it nice, calm and control, or is it just really fast and anxious? That really plays into those pelvic floor muscles.
Wow, that's incredible. I didn't know that. I didn't know that the what'd you say, the head and the pelvis at the beginning of birth are together.
Yep.
Wow. I didn't know
So,
that. Oh, I mean, it makes sense. It makes sense, but like, pointing it out, it's like,
and
okay.
there are
Yeah.
different
So that connection.
activities like I'll have patients do, like say if their urethra in the pelvic floor is not firing, it's like the lips of your mouth. So there are certain mouth activities you can do to get the urethra, first layer of the pelvic floor, to start firing or to activate, that they'll do here. Or if we need the pelvic floor to relax, we can have them do something like horse lips where they, and you'll feel your pelvic floor drop. That relaxation is happening down there, but also up here.
That's wild. Okay. That is really, the body is so
I love
amazing.
it.
It is really
Yeah.
fascinating. So we talked a little bit about exercises or just like habits that you can incorporate into your daily lives to improve pelvic floor health. You mentioned some cultures that around the world that do this just inherently as a part of their everyday civilization. How can we make what else do you recommend outside of maybe there's some nasty people out there not brushing their teeth? You should be brushing your teeth, people. It's a marker of your health and your hygiene. Okay, brush your teeth. But let's say it's crazy and I'm flossing in the car or whatever. Like, just give me some other
Idea.
scenarios in which you could do the toothbrush for 2 minutes
So another one is like
or 10 seconds or whatever.
if you have a dog or a cat that you're feeding them or putting their water in the bowl, how instead of folding, rounding the back, can we get squat down or half kneeling to even feed the dog or the cat? Put your kid's shoes on another way instead of rounding. Getting your kid in and out of the bathtub or out of the car. Can we think about our form with that? If my patients are doing that, to me, that is just like, hey, you tackled your pelvic floor exercises today because you thought about it with this activity. And that's going to start to continue to play over and over each time you're doing it. But yeah, putting on your shoes in the car before you get out of your car, before you're going into the office or you're picking your kids up from the carpool line, breathe, focus on the breath, removing your tongue up to the roof of your mouth, in and out through the nose, letting the pelvic floor relax. I like to give myself 3 breaths before I come from the parking lot into the clinic. When I leave and I get into the carpool line before my kids come in and are crazy noise, and then they go into the house and I take another little moment to just relax. So taking time to implement the breath throughout the day to calm the nervous system down even is huge for the pelvic floor muscles.
Okay, that's great. And that's the practical side of it. And I know that I'm going to get hit up in my Instagram DMs if I don't ask you about the nerdy scientific side of it. Like talk to me through the musculature, the infrastructure of the pelvic floor and the scientific terminology, and then what's the main function or secondary function of each muscle.
Of each muscle?
The muscle.
So we're
Yeah.
working through the breathing because most often, again, I spoke how majority of the people that come in are high tone, they're tense, and we see a lot of dysfunction with that. So the breathing is allowing those pelvic floor muscles to go back to that full range of motion, that relaxed state. So we see that with our arms and our legs. If we're not using our arms, we can relax them out to full range of motion. And we're trying to get that pelvic floor to go out to that full range of motion. So then we need it to, if you're in the car and you're coughing, sneezing, or you happen to tell your kids like to stop screaming at each other and maybe your voice got a little higher and it's going to challenge that pelvic floor. That pelvic floor is out at a full range. So when it has to contract, it can have that full range of motion to contract to support you. So we're not peeing our pants when we're coughing, sneezing, or laughing. Because if it's contracted, it's a shortened range of motion. It fatigues out and it does not function well in a short range. So think about that with the bicep curls on arm day. We talk about what kind of range we're going to be lifting from and what's the best for those muscles. But a muscle that's stuck at a full tightened position, we're not going to gain any gains essentially by doing a bicep curl at a very shortened range of motion because that's not how the muscle functions. Does that help?
Yeah, I know that makes sense. That makes sense. Is there any like pathology that we should be aware of downstream if you don't take care of your pelvic floor muscles? Usually, you mentioned some symptoms around like tailbone, but like where does it escalate? Like if you have a chronic pelvic floor problem and you don't address it and it goes for years and years and years, you mentioned like things, not being able to get off the floor in your 50s and 60s and 70s, but like maybe like what's the most common worst case scenario?
I personally, I think pain with intercourse is probably one of the worst ones. I have dealt with that myself.
Yeah, go deep on that.
When you're dealing with a muscle that's completely tight, you're thinking decreased blood flow, lack of circulation. So those muscles, so think like clenched fist. Those muscles are going to be tight, uncomfortable when you go to touch it. And when you kind of come out of that clenched phase, it's sore, it's uncomfortable. We have to pump that tissue, pump that muscle in and out a few times to get that blood flow circulation to get it to feeling well again. With pain with intercourse or pelvic pain, that contraction's there. So when we're trying to insert something in or touch that tight tissue, it's uncomfortable. If we continue to try to touch it, it's just going to contract to protect itself down there, which then creates this vicious cycle of continuing to have pelvic pain. But the contraction again can happen with stress, anxiety, or most of us don't even know we're clenching down there. Like that's a stress mechanism for us on how we're managing symptoms or day-to-day life, that it can turn into that, but then turn into bladder leakage, then turn into back pain. We can get pelvic organ prolapse with that. We can get tailbone pain, hip pain, back pain, all sort of things that I see patients for when, if we could just get that pelvic floor to let go a little bit more often throughout the day or get it back to that full range, it's working how we want it to. But if we're not tapping into, we get in this vicious cycle of living day-to-day life without doing any mobility added in or relaxation, then those muscles are probably going to start to go in that high tone. And then we call that chronic pain after like 12 weeks of it.
Yeah. So you're saying if your pelvic floor muscles just stay tight, you're going to have pain, and it's going to manifest in the form of a handful of different ways. But if you leave it there for long enough, all the ways.
Yeah.
Pretty much. Yeah. Over time. Okay. That makes sense. Yeah. Generally speaking, I know it's hard to definitively say yes to some questions when it's so patient specific. Definitely understand and recognize that. So, okay. So I've got like a couple more questions, and so it seems like you were already mentioning this. So let's expand upon it. One of the most, I guess, unsought after benefits of recovering, strengthening your pelvic floor, getting that full range of motion, that expansion, that contraction you're talking about, is the increase in the pleasure that you get, the experience that you have sexually. And not a lot of people are going to talk about that because, you know, again, people like giggling, it's like they're going to talk about sex again. But yeah, for sure. And because it is so important. And, you know, one of our fundamental properties and purposes as human beings is to procreate and to recreate life. Yep. And so this conversation for you a lot of times turns into that, where it's like you come for one thing, you come because of this chronic pain, and all of a sudden 6 months later it's like, whoa, I didn't know that I was I don't, how would you say, not that into it.
That's what I think people are surprised. They don't realize, like when we're going through an intake form and I'm like, do you have lack of orgasm? Can you experience an orgasm? Is it happening every time? Is it not happening every time? Is there ever pain with orgasm? And we start to, even men as well, like arousal and ejaculation, like are we having those type of symptoms with it? And I think everyone's surprised when they come in like, whoa, didn't think we were diving in that deep. But you have to, for us to know how these muscles are functioning well, because that's a good idea. It gives us a good insight. Because as I mentioned, like range of motion of the muscle, if a muscle does not have full range and then strength within that range, full range, it's not going to function well. So an orgasm is happening because it's a contraction and relaxation very quick of those muscles. But if we don't have the range to relax out, we're not going to see that orgasm be at the top peak. And maybe it's not hitting its peak because we don't have that kind of range. With getting orgasm or even just arousal down there, maybe somebody's not reaching orgasm, you're still going to have good benefits with the additional blood flow and circulation down there. There hasn't been a study yet on the female pelvis, but within the male pelvis, I believe it was 20 or 21 times of orgasms throughout the month that decreased prostate cancer by 20%. So if we think of men and women's pelvic floors really aren't that different. We mentioned vaginal opening for a female, the genitalia shifts a little bit, but they're pretty much the same. So if that study was done on a male and that much blood flow and circulation happening there and a decrease in cancers, we would hope that would be a similar response to ovarian cancer or uterine cancer. any other things that are happening down in the female pelvis. What we have noticed studies on with increased orgasms or even just arousal, and I think it was at between that 2 to 4 range per week, we have decrease in headaches. So ladies, you can never use that excuse again that I'm not in the mood, I have a headache, because it'll help it decrease, they say, by 80%. So lots of benefits from what we understand so far, just from the male research within that pelvis and what it can do for our organs and for our tissue.
Yeah, that's interesting to see how elementary the research, or early, not elementary. It makes it seem like it was simple. How early it is in the just research around the pelvic floor muscles in general. Let's talk about that just for a brief minute. Where do you think we're at in terms of awareness, in terms of scientific papers, non-industry sponsored independent studies, things like that? Are we doing well? Are we not doing well?
I feel, well, I mean, because I've watched it kind of grow since I've been in this world since 2008, and we've made big strides. So that's wonderful. I still feel like there's a lot of work to do. I want more research on the female side, on the pelvic pain and what is happening. Like, let's do a research on orgasms with women and see the blood flow and what benefits we can have. I want more research on cesarean deliveries and what's happening, because we're basing off that research on other scar tissue that we're seeing. It's just such a new avenue. And then I feel like people who are having the symptoms are starting to open up more and talk about them. So that's helping us on a statistic idea of how many people are dealing with pain with intercourse, bladder leakage, who has PCOS, endometriosis, that sort of thing. But 10 years ago, even, it was like thought of as 1 in 12 people were dealing with pain with intercourse. And now we know it's more like 1 in 3 people within their lifetime have it. So it's definitely changed in the last decade or so, but we still have lots and lots of room to improve upon it. And I think with the help of social media and YouTube, even, you have some of our more holistic doctors that are getting out there and, spreading, bringing more awareness and doing more research on it than we've had in the past.
Well, speaking of that, obviously your core and pelvic floor on Burn on Demand is there for members. Obviously, members get a big discount on it, but non-members as well can become a member of Burn on Demand and not only take advantage of core and pelvic floor, but 500 other videos, live streams every day that follow the Burn Bootcamp protocol. And really anywhere in the continental United States can join in and be a part of the Burn Bootcamp family. You can download the Burn app on the Apple Store or the Google Store. So Android and iOS. And so I would love for you, if you just talked a minute about what went on behind the scenes there when you were filming, how it's been, what the reaction has been, maybe your favorite DM or story that has come from somebody that's begun the programming that you have uploaded to Burn on Demand.
It was a really cool experience. And I feel like the Burn team was just so laid back and helpful. So I appreciated that. I'm used to talking on a cell phone and talking to stories all day. But when it comes to the whole setup, it was totally different, where nerves started to kick in. And I think Matt was like, you've got this, you do this all the time. I'm like, okay, you're right, I can do this. And from, I think, the media standpoint, from social media, it's just been amazing to really hear people are watching the videos and then seeing a change, seeing an improvement. And then they might dive a little bit deeper, but it's always fun to get a DM of oh my gosh, I tried tits over toes at the camp this morning and it changed my life. I can now do double unders, or I'm doing, things that maybe I wasn't doing on the floating floor that I'm doing now. And I love receiving those type of things. And I'm like, this is why I do what I do.
Yeah, that's super cool. And I have heard many stories of pelvic floor recovery over my years as a trainer, but exponentially more since you've been a part of the brand and have really been preaching it. And we appreciate you dearly.
Thank you.
There's a lot of myths surrounding pelvic floor. The one that I mentioned earlier is I just pee. That's what I do. I'm supposed to pee when I do a jump rope. And that always struck me as odd. I'm like, I'm pretty sure you're not supposed to pee. We should be able to do jump ropes without peeing. This is a pelvic floor issue. And if you go attack it and you rehab it, you can get back to double unders without having to pretend like the pee in the middle of your pants is sweat.
Yep.
Okay. So why do people think it's normal? Why, like, or people also commonly, they commonly report like when they sneeze, they'll pee too, right? So why, like, jump ropes in the gym, outside the gym, sneeze? Why is it normalized? Why do people think it's normal?
I don't know. I think we got that from our mom and our grandmas. Like, society was just like, oh, this is happening. It must be normal. It's not normal. It's normal to keep it in. Like, those muscles have sphincters. They're supposed to cut off the hose where nothing's coming out. But we want to stay active and fit. So I feel like when we're leaking, and we've heard from our moms, like, it used to always be, it's normal because I've had children. Like, they just want to keep doing it. And it's fine because I've had a baby, so I can do this, but it's not. Your tissue's literally telling you something's happening that shouldn't be happening. So why don't we modify what we're doing and see if while I'm at camp, if things will improve. And if it's not improving to where I want it to be, then let's go see somebody so we can get it taken care of. And I don't have to wear a pad or Depends or show my sweat, which we do sweat down there, but show my leakage to everyone at camp, essentially. Like, get it taken care of, because it won't improve on its own.
Okay, so my last question is, I am on your Instagram right now, and if you guys are watching this on YouTube, here it is, or if you're watching on Spotify, and you say avoid the abdominal binder. That is the last post you made 17 hours ago, and people can find you at empower.your.pelvis, empower your pelvis, if they want it more. But I wanted you to explain this because you have like some like big tall underwear in this video. It's supposed to give you some, these are binders. They're supposed to give you support, supposedly. Talk to me about this.
So the abdominal binder, I am ashamed of myself. Like, I went through the stage of getting an abdominal binder. It's like a corset. Well, we know through history, even in the past, if you look up the 1800s of women wearing corsets, like, people passed out. They couldn't breathe. They couldn't move their rib cage. It was putting a lot of pressure in and down. And after 2 babies of wearing an abdominal binder and having 3 C-sections, but after 2 C-sections wearing the abdominal binder, I developed pelvic organ prolapse. Pretty sure from the binder, because it is squeezing in and that pressure has to go somewhere. So mine went out vaginal opening and I had to deal with rehabbing myself from pelvic organ prolapse. So there are products or garments now that are more lymphatic flow compression, which is great for postpartum if we have vaginal tearing, if we have a cesarean scar, or if you have like a hysterectomy even, that it gives a little bit more support midline, but it's not a lot of compression where we're pushing the pressure in and down. So it's supportive in nature with moving things up the kinetic chain without it going down and out. So that is the reasoning behind that video.
Well, you've got so many just great tips. There's one on pelvic floor PT for working mom. You're doing something in your bathroom with them on what happens at pelvic floor physical therapy. So all the stuff that we're talking about, people can go to your IG and just check you out and just get an insight into everything you do at the clinic. So your team, what you got, 6 or 7 people there at the clinic?
7.
How many there? Yeah. You guys got a strong little team, and it's just really exciting to see you grow. We're happy to help, right, spread the awareness and drive people to your page. One of my favorite posts more recently, it had like 751 something shares. Well, it does. Yeah, 750. It is the one where you're in your car. It went wild.
Oh, was it talking about my boys?
So, you're talking about your boys. That one went wild. So I just wanted you do great content. So I wanted people to know that they could go follow you and they can get their pelvic floor game right. Amanda, this has been great.
Thank you.
It's been awesome. We gotta get going. I think that's good for today. Any last words?
No, you guys are helping me live out my mission. So I appreciate you all more than you know, because my mission is to normalize pelvic health awareness and bring light to it and let people know there's hope. You don't have to live with your symptoms. So I appreciate you guys so much.
Yeah, well, we appreciate you right back and everything that you're doing for Bird Nation, and especially there in Lee's Summit with your crew. But We'll do more on Burn on Demand too.
Awesome.
Okay, we'll do more. We'll do like a 2.0 series or something like that down the line.
We need
here.
to get you guys
But
out
we really
to the
appreciate
Chiefs Stadium too sometime.
I know. I mean, I'm here. I'm waiting. I can get there in a couple hours. So you just let me know.
It'd be awesome.
All right, everybody. That's the podcast for today. Empower Your Pelvis on Instagram. You can go hang out with Amanda and ask her any questions. And please, if this helped you, if this gave you a nugget, let us know. I want to know what you guys are taking away from this. Leave us a review on Apple, please. That'd be great. And I think that's all I ask of you all today. Otherwise, have a great day, you guys, and keep moving. 2 claps on 2.